Hello everyone, this is Sarah Brinkman with the National Rural Health Resource Center. I'd like to welcome you all to the third and final webinar of the 2015 SHIP Lean Training and Mini Project. I would like to introduce our instructor for the course and this webinar, John Roberts. John is the CEO and President of Midwest Health Consultants. He has a Lean Healthcare Black Belt and an extensive background in successful Lean implementation with over 35 years of professional healthcare experience. And John, I'll hand it over to you.
Thank you, Sarah. Happy Friday afternoon to everybody. Before we get into the actual webinar for today, I want to just make a couple of comments to reemphasize what Sarah talked about earlier. Please sign up for the individual technical assistance. I see that I think there's about 7 facilities that have taken advantage of that so far. That's a great opportunity for us just to get to know each other better, for you to ask questions, you or your team, about anything we covered, anything about the upcoming project, any other kinds of questions you have about specific Lean tools. So please take advantage of that. I'm excited to do that, and it's a fun part of the job. The other thing I just wanted to comment on was the submissions of the waste walks. I was overall very pleased with the submissions. Hopefully you found it to be a valuable exercise, and like any other skill, looking at waste and being able to identify it is a skill, and the more you do it, the better you get at it. And so I would encourage you to keep doing that, keep looking for that type of waste as you go throughout the next few months. Okay, it looks like we're presentations up and going here.
Should be, and I've given you presenter rights, John.
Okay, they still haven't come up as presenters right yet.
Oh, you just fell off again. I had you as presenter and I keep losing a connection with you for some reason. If you'd like, I can advance the slides for you.
Okay, that'd be fine.
Okay.
Today we're going to, over the first 2 webinars, we talked a lot about Lean methodologies, Lean thinking. We talked in the first webinar about the principles of Lean, and in the second webinar we talked more about some specific Lean tools. Today we're going to talk a little bit about building a Lean culture. We're going to talk about the concept of Kaizen in Lean thinking. I want to cover with you some basics on Lean metrics and how we measure the different types of projects that we do in our facilities when using Lean concepts. And then we'll get into specifically talking about your upcoming Lean project, and we'll, I think we'll have plenty of time for any questions and answers that you might have regarding that. So let's talk about building a Lean culture. Hopefully in the waste walks you've seen the ability for us to identify those different kinds of waste throughout the hospital. And we can build and use the Lean tools to be able to correct that. But what we've learned from our work over the last 6 or 7 years with critical access hospitals, that having the tools alone is not enough to be able to sustain projects and to be able to build a culture that's constantly looking at and focusing on the patient, eliminating waste, and building a culture of continuous improvement. So I really want to talk today about the second part of any successful Lean implementation in your facilities has to include the concept of culture. And I know you hear culture all the time, whether it's any type of other programs, whether it be quality improvements or team steps or any other thing. We all talk about culture. And I'm sure sometimes your eyes glaze over when we get to talking about that. But really for Lean and building the kind of organization that is a lean thinking organization that implements these tools and these processes and these methodologies on a consistent basis, we have to take a look at the cultural issues along with that. So it's not enough just to know the tools and techniques, the value stream thinking, to be able to deploy the tools. You also have to begin to think about how are we going to change the culture in our organization. And that really has a social component to it in addition to the tools and techniques in Lean. It really helps us to build a learning organization. It helps us to develop advanced team building. It allows us to build a culture that's looking at continuously improving the quality and the processes that we do each and every day. It also allows us employee empowerment and employee engagement. So when you think of the proverbial iceberg, the things that we've talked about up to this point, the 5S, mistake proving, A3 problem solving, value stream mapping, really those technical tools are really a very small part of an organization's journey to becoming a lean enterprise. The big bulk of this is really changing people's way of thinking, changing people's way of doing business on a regular basis, and that really involves what we call developing a lean management system. Basically, a lean management system is just a very calculated, strategic way of implementing lean and lean thinking all across your organization. And we'll talk more about it, specifically what that means, but from our experience in the hospitals that we worked with, critical access hospitals that we've worked with, the hospitals that have been most successful are the ones that have been able to spread this thinking and methodology across the entire hospital, from the CEO all the way to the frontline staff. Those that have been able to do that have been more successful in sustaining what they've learned and what they can do with Lean over a longer period of time. So I really want you to think about not only the tools, but this issue of culture and how do we build culture and how do we engage employees and frontline staff in lean thinking across the board. When we're talking about changing cultures, we're really looking at changing from what I feel is like a traditional culture to a lean culture. And you can see on the slide there that what we really mean by that. In a traditional culture, we tend to focus on the providers and what's convenient for the providers and for our staff. And we want to shift that again to lean thinking, which is always focused on what is the best and what's valuable for the patient. In our traditional culture, we have many times in the hospitals we work in, people, when they discover problems or issues, they tend to hide those issues, or they build workarounds to those issues and problems. In a lean culture, we want to highlight those problems. We want to bring those to the forefront. We want to engage everybody in meaningful problem solving on a day-to-day basis. In our current traditional cultures, we tend to blame people when things break down in a process. In a lean thinking, it's almost always the process that breaks down and not the people that are doing the process. And again, we want to make sure that we're implementing the lean tools and philosophy across the board, decreasing waste, process-driven, looking at root cause analysis, all those things really deal with putting together a lean culture. What we found in working with many of the hospitals that we have is that people in the hospital really catch on pretty quickly to lean. If you think about it, healthcare is all about diagnosis and treatment of illness. And lean is really about the diagnosis and treatment of processes. And that's why we see that when people are given the right types of training and education on lean, that they really pick it up pretty quickly because they can see the advantage of using it in their day-to-day jobs and what they do for the patient on a daily basis. Our goal really is to get the culture to do what you guys have done in this process, and that's begin to look at what you do and what happens in the hospital in a new way, seeing with new eyes, looking at processes and value streams and what happens along the way. So really, to be successful as a facility in lean and using lean methodologies, the success comes from not the tools, but it really comes from the culture. It really comes from what in the Toyota methodology of working and putting this process together is what they call respect for people, really focusing in on the people and the culture and providing what they need to be able to implement the lean thinking. When we look at the quote-unquote Toyota way, they really build it on two different columns. One is this idea of continuous improvement, that they look at a long-term vision of continuous improvement. They really have taken the long step approach to looking at process improvement and quality improvement along the way. The other thing is they're constantly looking at improving their operations, and we'll talk more about how they do that with the concept of Kaizen. And the third area under the continuous improvement is really going, like we talked in your waste walks or Gemba walks, going and really seeing what's happening in the operation and being able to look at that and to identify those value streams. The second column is what they call respect for people. And it's really making an effort to understand each other, to build teamwork, which takes responsibility, mutual trust. And probably the third one is probably one of the biggest one in the lean concept of building a culture. And that is looking at individual performance to stimulate personal and professional growth within individuals. As we'll see in a second, that's the key to looking at creating this kind of a culture. And again, we maximize individual and team performance and when we're building this culture and the respect for people. When we look at a culture, when we look at this concept of respect for people, we really look at individuals. And we go by this philosophy that to really get a breakout performance by an organization, you can only achieve that through individual breakout performance. And so that's what really drives organizational breakout performance, is having people break out in their individual way of thinking and start pushing forward. No great organization with high-performing people as an organization can do that unless we have high-performing individuals with the organization. So who are the experts in this culture that we're trying to build? The experts come from people on the front line. That's why we want to involve everybody in this lean culture. We want to engage frontline people in the concepts of lean because they're the experts in the process. Nobody knows better on how to improve their job than the people who are actually doing the job. But it's quite rare that we actually ask them how to do that, how to improve what they do and the outcomes that we get for the patient. When we build this lean culture, it's not management that's telling people how to improve. We really flip it 180, and it's the frontline people that are telling the management on ways that they feel like they can improve the process, improve the outcomes for our patients and our facilities. So when we build this lean culture, we see certain characteristics. One of those is that we see small teams of people consistently on a daily basis looking at how they did yesterday and how they can improve tomorrow. And so this is a constant just way of doing business, a way of doing their jobs, of constantly looking at continuous improvement and how they can make things a little bit better today. And then we also see leadership that's focused on helping those frontline staff, those people within the organization in their problem-solving muscle, or building those skills to be able to problem solve on a consistent basis using the lean tools and methodologies. Most of the studies that look at lean culture and how successful hospitals are in implementing lean, that research shows that 62% of the time that initiatives fail in facilities is because of lack of senior leadership commitment. And so it's very important, I think we've talked about this earlier, again, we want to drive this out throughout the organization, but we need to have that senior leadership with the commitment that they're going to pursue and push through the difficulty in implementing lean sometimes, and that they're going to do it regardless of how difficult it can be. We find without that senior leadership that most of the time lean and the gains that we can gain through lean and lean thinking don't sustain themselves over time. They gain momentum for a short period of time, and then they lose that as they move forward. What we want to build, and what we've learned here from our work here in Nebraska with the critical access hospitals, is that we want to build a self-sustaining lean culture. And we learned this the hard way. We learned this through some pilots that we did with several different hospitals, and we really learned that to be able to sustain lean and lean thinking over time, we have to build the capacity within the facility to be able to do that on a long-term basis. So how we've done that is really looking at developing a core of expertise and skills within that facility. I put on the screen no more consultants, and that's pretty unusual for a consultant to say, but you can use consulting people to get started in this process. I don't think there's a problem with that, but you can't rely on outside consultants to be able to do this work and help you on a consistent basis and be successful long-term. You have to build and train people in-house, and that comes from a variety of training, whether it's a black belt, a green belt, or a yellow belt. If you're not familiar with what those types of statuses are in lean thinking, a black belt is somebody that's trained very extensively in lean methodology, can really lead projects, can coach other folks, green belts and yellow belts, in the process. Green belts are people that can run processes, can do projects within facilities, and lead those projects. They have gone through a process of learning the skills, the tools, what can be done and can't done in lean thinking. And then yellow belts are people who have a basic level of training, who know how to participate and have the basic knowledge and skills to be able to participate in a project and be a valuable person on that team who's doing the project. What we've seen is that when hospitals, critical access hospitals, can get anywhere from 8 to 10 green belts in their facility, and those green belts can turn around and train the rest of the staff in kind of the yellow belt status, that's when we begin to see some real gains in building this culture and this capacity to be able to do this kind of work on a long-term basis. So we feel like the key of building this capacity in the building of the culture is really developing the in-house expertise. And so it is. I'm sorry about the technical difficulties. For some reason, we keep cutting in and out. So again, I think the goal that we're looking for is to build a lean culture within our organizations.
John, are you able to see the slides?
Just the last one. I can't see. I can't advance the next one.
Okay, I've got you at the next slide, the one that's titled "This is not for the faint of heart."
Yeah, this process, I think folks get into it and really gain some short-term success, like I know you guys will here with your lean projects. And then, but this work is pretty hard overall. It's changing the way we currently do our business. It is looking at changing the way people do their jobs. And I can guarantee that if you pursue creating a lean facility, a lean thinking and facility that uses lean concepts, you will have difficulties in doing that. You will get pushback from staff and clinicians and physicians being able to implement those things because it's a change, and because it's a change in many times the way we do and work in our jobs. When we get this process of building the lean culture going, we get these what I call proof of concepts. We get these small projects that really show improvement. We're getting early good results. And so we keep pushing through the next stage of that, and that is we get cautious learners and serious students. A lot of people will be standing on the sideline when you do your projects and looking at and see whether or not this is going to work or not. And if it does, then some of those people will then come on board when they can see that you're actually gaining some pretty significant results with the lean tools that you're implementing and working with. To really get to the tipping point, we have to really make this persuasive throughout the organization. And what we know from the research and what work we've done with hospitals is this process can take anywhere between probably 5 to 6 years. And so that's why we say it's not faint of the heart, because it's going to take time. It's going to be an uphill battle, but once you get to that point and you just becomes the way you do business, that's when we see some really breakout results with organizations that implement lean. Building this lean culture really means winning hearts and souls one at a time. It really means helping people understand what the concepts are, how it's going to help them in their job. We talked a little bit, I think, earlier about everyone tunes into the same FM station, WIIFM, what's in it for me. And so we have to be able to do that. We have to be able to show that people that we're building in this culture what's in it for them and how this can improve their jobs. Each individual comes to the commitment at their own individual pace, which means that not everybody is going to jump on board all at the same time. And so when we have our lean management system, we have to respect the fact that all people won't come along at the same pace. And so we have to respect people and look at their ability to come along through this process and learn and go at their own pace. And so we have to really be cognizant of that.
John, I can advance for you. I have the next bullet up if you're ready.
Okay, thank you. Again, some take a little longer to embrace it, but I know from what we've done in hospitals, some of the people that were the biggest skeptics at first are now our strongest advocates, and you can take advantage of some of the informal leaders within your organization. Next slide. Again, you'll know you're building this lean culture when everybody's engaging and looking at and identifying waste and how to eliminate that and how to streamline processes on a day-to-day basis. Next slide, please. What we've learned, some of the lessons learned is that, again, commitment from top leadership is the foundation of any transformation. You will get resistance from physicians, clinicians, and staff. I get a lot of questions on how to get physicians involved with lean and lean thinking. The best way to do that is to show them results and to show them data. And if you can show them good results and show the data of great outcomes, most of the physicians that we've worked with will come on board with the process. And again, we want to look at important ways to look at engaging these people all across the board. One thing I think it's important to do is lean's different in many ways than other quality improvement processes. Most don't look at waste like we do. Some have obviously process improvement. They have focus on the patient, but lean and lean thinking is really has that component of waste that we're looking for. So persistence really is the key. Next slide, please.
We're at the concept of Kaizen.
Okay. Thank you. I apologize for the technical difficulties. I'm not sure what's happening here. The concept, hopefully we've at least given you the importance of not only looking at lean and the lean tools we talked about, but developing this culture of lean thinking and how important that is as we implement lean and the methodologies within our hospital. Another important component of lean is the concept of what they call Kaizen. Kaizen really is a very simple but very powerful technique that can be used in hospitals and in other organizations. The concept of Kaizen is really looking at a process and breaking it apart and then putting it back together. It's really small incremental change on a consistent basis that really gets you breakthrough results. If you can go to the next slide, please. So let me ask you this question. If I ask you that if you could improve 1% of what you do in your job today, do you think you would be able to do that? Just 1%. Just 1% improvement on what you do today. And I think most people would agree that, yes, they could improve by 1% of what they do in a typical day. So let me ask you the second question. If you could improve 1% on a daily basis, on a consistent basis, where would you be in 1 year? The answer, obviously, is you'd be 365% better. When you get that kind of performance, that's what we call breakout performance. And that's what the concept of Kaizen really is in lean thinking. Small, continuous, steady improvements over time will get you as an individual and your organization breakout performance. As you can see, Kai is the Japanese word for change, and Zen is for the better. So really what we're looking at is this concept of small incremental improvements that really add up over time that really can give our organizations breakout results. Next slide, please. The important part of this concept of Kaizen is really looking at eliminating that waste from our organization and really performing at the best level we can each and every day. And really looking at building within our organizations the compounding effect that it has on development. And if you're looking and your staff's looking at how they can improve each and every day, that's really, I think, the basis of the Kaizen concept. Next slide, please. We use Kaizen for what we call low-hanging events, low-hanging fruit. Kaizen is, the concept of it is looking at and seeing problems on a daily basis and seeing those problems and seeing a solution that is so obvious that it's a no-brainer just to go ahead and make those changes and fix those kinds of problems. Usually have a quick consensus on a solution, and the solution is very easy to implement. Many times I'll go into a hospital and we'll talk about an issue or a problem, and I'll ask the person, how long have you known about the problem? I said, well, you know, we've dealt with this problem for a couple of years. And my next question is always, why, if you know it's a problem, how and why don't you try to solve that problem? And many times the answer is because nobody told me to, or I wasn't directed to, or I'm not sure how to do it. Again, Kaizen and that continuous thinking of how do we improve things on a consistent basis really unleashes folks to be able to solve problems that are this low-hanging fruit on a continuous basis. Next slide, please. When we have Kaizen, what we call Kaizen events, they're very short bursts of activity. They're very focused on a specific improvement on a very short period of time. And the bias is towards action over analysis. We make the change, we decide what needs to be done, we use a cross-functional team, look at upstream and downstream implications, and we make the change right away. Again, if we do that on a consistent basis, day after day after day, think about how much you can improve over time. Next slide, please. Who should be involved with the Kaizen event? Again, we want the frontline people to be in this process. We want them to be engaged in feeling like they can solve problems on a daily basis. And again, they're the best ones in the best position to be able to know what the problems are and the best way to try to be able to solve those problems. So we really want a broad base of people with this Kaizen concept of looking at how they can improve what they're doing on a daily basis. Next slide, please. Our main goal of using Kaizen is to develop a group of problem solvers throughout the organization. And they're daily practicing observing and looking for and identifying waste. They're analyzing how they can eliminate that waste or cut that waste back. And they're implementing solutions on a daily basis to improve the process, to improve the outcomes for our patients. Next slide, please. Again, Kaizen is really a mindset. It's this issue we're talking about today of building this culture, a mindset to be able to admit problems and to be able to see those problems, identify those problems, and develop solutions for those problems. I see in too many hospitals that I work with right now, I see people add 3 or 4 steps to a process, which is what we call workarounds, because they don't want to deal with a particular department, or they don't want to deal with a person, or they had a problem 3 years ago, and to try to solve that problem, they added 3, 4 more steps to the process that didn't add any value to that. And so we've really become, in the hospital industry, really proficient at building workarounds. And again, we want to engage people and empower them to be able to see problems and to eliminate those problems as quickly as possible on a consistent basis. Next slide, please. Again, this concept of building Kaizen and a culture really is about respect for people and building the skills and abilities of your people to be able to do their jobs better each and every day. And I truly believe that when we go into whatever this next phase of healthcare reform is, that the ultimate competitive advantage for hospitals will be their people. Will be measured on value-based issues and reimbursement, and really that comes down to people and being able to engage people and have people have breakout performance. There's a great book I put on the screen there for you by Mark Graben, which is called Healthcare Kaizen, Engaging Frontline Staff in a Sustainable Continuous Improvement. It's really a good book. I'd highly recommend it. I think it's on the resource guide to explore this idea of healthcare Kaizen and really engaging frontline staff. Next slide, please. So let's talk a little bit about lean metrics. Lean metrics, and I put a couple of things on the Moodle website for you. I put a guide on what types of metrics we're looking at when we're talking about lean thinking and what categories they go to. When you're thinking about your projects and when you're working on lean, from the students that I've worked with and the hospitals I've worked with, the measuring of those projects is probably one of the most difficult parts of the project. And you really have to think about, before you get into your projects, and any improvement or lean implementation you're going to do with the tools, you really need to think about how we're going to measure it, whether the benchmark's going to be up front so we know where we're at in our current state, and then when we get to where we want to be, our future state, or the countermeasures we put into place, how do we know those actually worked for us? Really, measurement is the cornerstone of continuous improvement. It really identifies whether or not you're improving or not. And if we don't measure things, we're really not sure if we're actually improving things. And so we need to make sure we're picking the right measurements. We don't need more measurements than a whole group, but we need enough measurements that are in the right areas to tell us whether or not what we're implementing is working or not. Next. Again, when we use metrics and lean initiatives, we want to identify the right ones that are going to be most appropriate for what we're trying to accomplish. Again, we want to evaluate that process improvement over time, being able to do and establish a baseline of data and outcomes data. And again, that helps us understand whether or not the things that we're implementing are actually working or not. Too many times I think we implement solutions in our facilities and we think we've solved the issue, but we really haven't. And the only way to be able to do that and to look at and sustain improvement over time is to be able to use metrics in a way that can help us do that. Some of the metric categories that we look at when we're talking about lean, we put here, and I put some examples for you. We look at process complexity. We know that the more steps there is in a process, the more likely it is to break down at some point in that process. So we look at things like how many handoffs there are, how many process steps there are, how many value-added steps versus non-value-added steps. What are the decision points we have to make? Those are all things we can look at and measure in this category of process complexity. Quality, you guys are very accustomed to some of those measurements, things like patient satisfaction, defect rate, medication errors, fall errors. Anytime we have to do rework, that would be a quality issue. Again, those are things that we can measure. We can look at time metrics like lead time or processing time, value-added versus non-value-added time, response time. All those things, again, are under the category of time that we can measure. Obviously, we can look at cost measures, cost savings by eliminating waste, labor savings, total processing cost, inventory cost, all those kinds of things we can measure. Outputs, looking at production, work in process, inventory, and then our last category, major category, is organizational. How many lean events did you do? How many people participated? How many people are trained in your facility? Employee satisfaction. One of the greatest things that we see in a lot of our lean projects that people complete is that we see a huge increase in employee satisfaction with the completion of the lean project. Why? Because they see that we've taken this problem, we've eliminated some of the problem, and that it's made their job easier along the way. And so those are the major categories of metrics that we look at. And again, in the guides that I posted on Moodle, we'll give you even more detail about the metrics, about what the categories are, about how to do some of those calculations. And again, you can also, anytime, Google lean healthcare metrics or measurements, and you can get a whole host of ideas about the way we can measure different projects that we're working on. And again, we have to look at what we're trying to accomplish in those projects and the outcomes we're trying to get to make sure that we have the right metrics for the job.
John, we're on the slide guidelines for measurement.
Okay. So the guidelines for measurement of for lean metrics are we want them to be strategic, relevant. We want them to be easily collected. Sometimes we have to get very creative on some other ways to measure. For instance, in some of the projects we've done, we want to track motion. We want to reduce the amount of motion within a particular process. So we have people wear pedometers, and we measure and get a baseline for how long and how much motion they have in a particular 8-hour or 12-hour shift. And then again, we implement the solutions and measure that again. And again, a creative way to begin to measure some of those the issues that we're trying to deal with. I'll give you an example of one of our students who did a pain management project. They wanted to reduce the pain level as defined by the patients. And so this is how they outlined how they were going to manage the metrics in their particular project. They defined what was an acceptable level of pain. So 4 or less, moderate severe was 4 or more. Again, they defined how they were going to collect that information and data. And then they were very specific about how they were going to define their measurements. They wanted to measure the number of patients reporting a high degree of pain by a certain percentage. They wanted the time to pain management to go down. They wanted the time, the percentage of untreated pain management to go down. And then hopefully the patient satisfaction scores improved. But this is just a quick example of how we use metrics in our projects to be able to, again, identify and measure whether we're being successful or not. So we're now on to selecting your lean mini project. We're in this process, we're asking each facility to do one project. We want the project charters to be handed in around April 24th or so. We posted on Moodle a draft template of a charter that you can use for your particular projects, which outlines the expectations or gives us a sense of how you're approaching your particular project and gives you some different variables to think about when you're putting together your project charter. We're roughly looking at the time to complete the project from May 1st through June 12th. So roughly 5, 6, 7 weeks to really do these projects. Certainly we can grant extensions if that's needed. If you're making your way through the project and just haven't been able to get to where you need to be to finish the project, we certainly can grant those types of extensions. And again, we want the final report to show what lean tools you used and kind of a more detailed project charter of what happened, what the metrics were, what the outcomes were, and demonstration of showing your projects. My recommendation on your lean projects would be to use either the 5S tool or the A3 problem-solving tool. I think value stream mapping is a great tool and can be very useful, but it's fairly complex. And I would be concerned of your ability to be able to get that accomplished in the time that we're giving you. Standard work, again, another great tool, but really used for sustaining projects long term. And so since we're just beginning these types of projects, I would recommend that you really look at a 5S worksite organization type project, or a specific project that you can use the A3 template to do that particular project. The project charter, again, template steps you through what the process is, what the issue is, what the description of the issue is, kind of what your main objectives are in tackling this particular project and what the outcomes might be. We want you to identify up front what metrics you're looking at. Those may change as you go through the project. We want to try to, again, establish that baseline. We want the project charter to really encapsulate the scope of the project. One of the most difficult things in identifying your projects is what we call project creep. It's that you get into these projects, you look at a lot of different issues, and pretty soon your project just becomes bigger and bigger and bigger because you're uncovering additional things that you hadn't really anticipated when you started out in the project. So we want to make sure that we have a good, solid focus on what the scope is, and then if additional things come along, we can, again, put those in a parking lot for later on, but we don't want to get sidestepped in additional things that keep us from accomplishing what the scope of the project is. Again, we want to look at the business case and the benefits, how it strategically lines up with what you're trying to accomplish. You know, it's been said that developing this project charter, when you do it, it's almost like getting close to having half the work done for your project. That's how important project charters really are. It really outlines what you're going to do, how you're going to do it, and forces you to think through all those things ahead of time. And again, how you're going to measure it, how we're going to know that you're successful. And so don't be surprised if it's difficult to do the project charter, because you're going to feel like, I don't know all the answers at this point, but do the best job you can in filling those out. And then hopefully over this next 2 weeks, you'll develop some ideas from your waste walk on what type of projects you want to get into. And then we can go over in our individual technical assistance calls, explore more about those different issues you might have on the project charter. Some of the typical problems that we see with project charters is that scopes is not clear. We don't have a leader that's going to lead the way. When everybody's in charge, nobody's in charge. So we want somebody to lead, be in charge of facilitating. They don't have to have all the answers for this particular project, but they have to facilitate that process. That's not linked to your strategy. I want you to pick out projects that are meaningful, that will produce a significant result to your organization, not just something that that you may want to try to look at that has no relevance to what you're trying to accomplish in your facility. Another problem is that many of the goal statements are what we call SMART and manageable, attainable, targeted, and those types of things. And then one of the last problems is when you think about who needs to be on this project, make sure that you have the right people in the project, people that are upstream or downstream in different departments that might be useful in this process. Make sure you identify them and they're part of the process. I've posted additional information on Moodle. We put the sample template of Lean project charter on there. I've put a couple of metrics guides for you to use. And then I've also put on there some quick start guides, 5S project a guide, and some forms and some assessment and planning checklists. Put those on, download those if you're thinking about a 5S worksite project. And then I've also put a quick guide to A3 problem solving, which will kind of hopefully get you quick started to looking at using A3 as the tool for your particular project. As I began with, and I again apologize for the technical difficulties today with the presentation, but technical assistance is available, and hopefully you'll sign up for the technical assistance call, which at that point you'll have some good ideas about what your project is, what you're going to do. You'll have at least a pretty good handle on your project charter, and then we can discuss those things and really get you set up for success in implementing this particular project for this process that we're using. So with that, I think our time's about up. I'd be glad to answer any questions anybody might have. And again, I really apologize for the technical difficulties that we had again today.
Thank you, John. If anyone has any questions, it's *2 to unmute your line, or you can type them in the chat box. And if there are no questions, oh, is there someone there?
Sarah?
Yes.
This is Sandra Ellis at Minnie Hamilton.
Hi, how are you?
I don't have a question, but I want to let you know that early in the presentation, we lost our internet connection. But I have been on the call, and I enjoyed the presentation and appreciate it, and just wanted to let you know that we were still here.
Oh, great. Thank you. I appreciate that for attendance purposes.
Thank you.
Absolutely. So if there are no other questions, a reminder that there's more information about those one-to-one TA calls that John is offering in the announcements forum. You can look there. There's a link to a doodle poll where you can choose a date and time for your team to take part in that call with John. I will send out confirmation messages to everyone in the next couple of weeks about the date and time for your call, but mark your calendars as you make those selections. And I want to thank you for participating